Hello, everybody. We are live. I know several of you joined here about 10 minutes ago. We had a little bit of technical difficulties, but we are all here together with our special guest, Matt Maddock, Representative Matt Maddock, who has had a very, very busy day already. And we want him to introduce himself a little bit, tell you a little background about himself, and then we're going to get right into it. I hope you brought some popcorn because this is going to be a meaty conversation. Matt.
Hey, Ron, thanks for having me on board here today. My name's Matt Maddock. I'm a state representative. When I'm not in Lansing, I'm a bail bondsman and a private investigator. I've been doing that for about 30 years. I first got involved in politics back in the 90s as a precinct delegate, and that's something everyone should take note of because precinct delegates are the lowest elected officials that appear on a ballot. And if you want to have some say in the trajectory and the direction of our Republican Party, precinct delegates are the people that determine that. They determine who our state party chair is, who our nomination for Supreme Court justices are, our lieutenant governor. So there's a lot of really important things that the actual delegates do within the party, and it's a great way to get started.
Well, we're just glad that you could join us on this short notice from yesterday. There's been so much that's been going on, and I know that the people with the changes in the governor's orders and what it is you've done. Let's just start right out with your latest information, what you've been talking about all day today, and that is the letters that you have that you're thinking about getting filed here in a very short period of time to potentially open up an impeachment hearings in regards to Governor Whitmer. Let's talk about that for a minute.
Well, absolutely. I mean, I think it's an important thing to do. You know, we've tried everything. We've tried protests. We've tried legislation. We've tried suing her in court, and she just completely ignores what the judges tell her to do. And we have no other recourse, unfortunately. She's kind of put us in this position right now. So we're not going to let her off the hook. She's responsible for many, many deaths here in Michigan. And you can't just make sweeping shutdowns of our economy. The Republican caucus put forward a great plan, a local plan where we let local officials make decisions on how they're going to proceed with COVID. And she ignored that too.
Well, we know that she did. And we also know that if we go back into March and April, and our people, we've talked about this for quite a long time. But I think it's important for us to revisit that. When she created the emergency order, she asked us and told us that we needed to do what? We needed to bend that curve in order for us to be able to take care of those that were sick. She explained to us that once we did that and we had adequate hospital beds, we had adequate staffing, we had the proper PPEs in place, that once that happened, we would have bent the curve because all it was an ability to take care of those that got this virus. That had happened in a matter of 3 weeks. But what happened for the next 5 months is what it is we need to talk about as we get into these impeachment hearings. And I'd like to have you were there during the House during those days. You were there when you extended her emergencies. And then obviously you were there when you didn't on April 30th. But talk to me a little bit about the process and frustration that you guys went through, because those are the areas we have to revisit during these hearings.
You know, it's not just the frustration the legislative body's gone through. I mean, you know, she told us that she was going to get us through this initially, okay? And part of the problem is her definition of success with COVID changes every week. At first, they closed everything down. We had a complete shutdown. She asked us to do that. We did that. That was to flatten the curve. We did that also. Then it's wear a mask, and we did that. Then it's wear a mask longer. We did that too. Then it was everyone get tested. We're doing that, and we did that. Now it shut everything down again. I mean, I see a pattern here, and I don't like it, and the legislatures don't like it either. You can't, you know, we shouldn't have to ask to have our constitutional government back after 8 months.
Oh, you're on mute, Ron.
I got your mic off. Go ahead, Tammy.
There you go. No, I was just going to tell you were muted. I could see your lips moving, but couldn't hear you. All right. No, I would like to jump in and just keep going on that vein, because what we're seeing, not just in Michigan, but all over the country, is that this is a very well-coordinated, well-organized approach to shut down, lockdown, and control. Because if you pay attention, all these liberal Democrat governors in these radical states are doing the exact same thing along the same timelines, and they're following the same playbook. And so what she did before, make no mistake about it. This is why we've been so adamant about starting, the refuse to obey hashtag and the encouraging now at this point total civil disobedience, because this is not going to be a 3-week shutdown. It's not like in 3 weeks we're going to all open back up, because she's already given us her playbook. And so that's why we need to look at what's going on across the country, look at what she's done before. We know her MO. We talked about this with Lana. She's very punitive. It's not like we don't know how she thinks and how she acts. So I think it's incredibly important for you as a legislative body to step in now and say, enough is enough.
Absolutely. I have a feeling that we may get our freedoms back in 6 years once she's termed out. And I hate saying that, but I think this is the direction this is going. As long as they keep testing for COVID, they're going to say it is tragic that we have COVID here, and China gave that to us. But I think we need to draw a line somewhere. Even though our tests keep increasing and our positivity rate keeps increasing, there's fewer and fewer people dying when you look at the ratio of people that actually have COVID, who have gotten through COVID. I know like 60 people personally that have had COVID, and only one of them had any serious symptoms whatsoever. Most people are telling me it's like a cold or a flu, and that's it. And it lasts 3 or 4 days, and they're done.
And that's why, honestly, that's why we have to look at this very realistically, and we have to lower the narrative. We have to completely get rid of the narrative of fear. Not just lower the fear, but we need to get rid of the narrative of fear. Because I was looking, if you look at how many flu deaths, it's cold and flu season. Let's make no mistake about it, right? It never fails. About 6 weeks after my kids go back to school, everybody starts getting sick. And kids are being sent home because of flu, and the illnesses go around. I always put my kids on extra vitamin C and zinc and things like that right after school starts. Well, all of a sudden we're having 0 reported cases of flu. But the symptoms of COVID and influenza are 100% identical according to the CDC, with the addition of the loss of taste or smell with COVID, which, that's not going to kill you. So we shouldn't be freaking out about this. We have a 99.97% recovery rate from this virus. And most people that get it are asymptomatic. And people that are wearing masks and have been wearing masks for 8 months are getting it. So what are we doing? And so I really appreciate your leadership. It is so timely. The people are, you should see the comments, Matt. The people are so excited.
Well, I tell you what, I could use some positive comments right now, because the attacks that I've been going through and the death threats have been quite surprising, actually. So it's been a tough couple days.
Imagine, and our team goes through the same thing, so I can imagine. But you are on the right platform. Let me tell you, there are hundreds of thousands of Michiganders who are so excited, and they feel like finally our legislators they're doing something. So you're on the right platform here. You're going to see, if you're able to see the comments scrolling. I don't know if you can see them or not off of your phone. But if you come back and you check back on this later, you're going to be really encouraged by the positivity and the support and the thank yous, because we're already getting that.
Well, you know what? I can't do this alone. I can flip the switch and call for these hearings, but it's going to require the legislature, and the mechanics of how it works is very, very similar to how it works on the national level. The House needs to make a vote, and if we have a majority of House members agree to hold hearings, then we 3 members are appointed to hold the hearings in the House. And then we start hearings, and I tell you, I have families waiting in line to tell us the horror stories about the people that they love who have died alone and scared in nursing homes. And I assure you one thing, I can tell you for a fact that if she had not carved out the legislative body, and if we had the deliberative process that we're entitled to by constitutional law, if we debated this issue of whether or not to put sick people in with nursing home patients, I guarantee you, after hours of debate, maybe it wouldn't even taken that long, there would have probably not been one member on that House floor that would have agreed to do what she did. And that's tragic. And that's what people should be thinking about, because we can't allow this to happen anymore. She can't make decisions on her own. But we have a lot of smart legislators in Lansing, and these people care about Michigan. And they're not going to do anything to put us in further harm. But at the same time, we need to respect the rights of other people who are trying to make a living. What about the 250,000 restaurant workers out there that are going to be unemployed over the holiday season? That's not going to be a very Merry Christmas for them.
Yeah, and we're actually hoping that they're not. We're encouraging them. Refuse to comply. Refuse to obey. Stay open. Stand your ground. You've got hundreds of thousands of Michiganders with you. And we agree with Dr. Scott Atlas from the Washington COVID Task Force, who actually said, Michiganders, it is time you rise up. He is encouraging Michiganders to refuse to go along with this shutdown. And we totally agree with him. It is time to take back our authority and our power and refuse to be shut down. And you know, I've never shut my business down. I refused back in March. That's why I got involved with Stand Up Michigan, because I recognize the unconstitutionality of her telling me I cannot operate my business. I can't be engaged in commerce that I'm legally allowed to do, make a living, feed my family, just because of a virus. Yep. So this is what we've been saying all along. And it's gotten to the point now that we are going to start seeing untold damage. If these restaurants close, they're not going to be reopening. Right. I've reached out to the Michigan Restaurant Association. I'm really waiting to hear what they say in response. I have not heard back from their CEO. Right. We're hoping that they come and they stand with us, you know, in support of the restaurants and the bars and the employees, the business owners, but all the employees, that their livelihoods, their families, as we go, like you said, as we go into Christmas, this is the busiest retail restaurant and retail time of the year. And they're already on life support as it is.
But think of what happens, Tammy, when we begin to gather together, we begin to share stories. Right. When we share stories, we then get strength with each other and we move forward. Our idea and her plan is to isolate us. Do not have Thanksgiving. Shut down your businesses and go home and wait. Don't worry, the government will help you. The solution is never going to come from the government. It is only going to come from we the people. The same way as I say, Representative Maddock and others are standing up, and we do have leaders within the House and the Senate who are strongly supporting individual rights for citizens. We are not denying that this virus has teeth. All we're saying is if you want to wear a mask and if you want to keep your business shut down, those are your individual rights and choices. But mandates should not be a part of this. We have seen no better group of people than the Restaurant Association of the restaurants who have made more sacrifices through this process.
They've done a great job. I mean,
they have
with that industry, and they're surviving through it, which is miraculous. You know,
it is miraculous. It is miraculous, and for their people who went through not being able to get unemployment and all of the things that they went through, and for them to even be able to have staff back, they have fought to get the staff to this point. And to think they're going to go back to takeout only, where they will lose money every week, with the exception of a few. We have already lost over 2,000 restaurants, according to the association. They're saying 6,000 additional restaurants and bars will be closed forever by spring if this doesn't change. And there seems to be absolutely no regard for the individual rights of these business owners or their employees. Yeah, and it is time for us to stand up together.
Let me tell you something else. I received a text message from a restaurant owner that I know. And evidently, from what I understand, is they shut down this restaurant because they used the Michigan COVID tracking software on someone's phone, and they found out that people were in the restaurant that had tested positive for COVID. So the Department of Health came by and shut this restaurant down, and they used the GPS tracking. To the best of my knowledge, the only way you could do that is use the GPS tracking that must be within this app.
That's so ridiculous. I mean, talk about a violation of privacy rights. This whole thing where you have to gather, you know, names, phone numbers, do the tracking. What a violation of personal and civil liberties. You know, I called the governor's office and I actually asked for her personal information, her address, her phone number. And I was told by her staff that, well, we can't give that out. That's private. And I turned that right back around on them. And I said, yeah, what are you thinking? Why is it okay for me to have to give out my personal private information when, guess what? Identity theft is the #1 crime in America right now. And you're asking me and all of Michiganders to just give you our personal information? Are you crazy? I mean, what kind of world are we living in where our government bureaucrats think this is okay? Yep. So it is really time for us to get vocal, very vocal, and spread the word and stand together and absolutely refuse.
Yep.
So I'm going to get on my tirade in just a minute, but before we do, I want to make sure that I cover a couple of questions that we have for people on here. And one of them is going to be, do you believe you're going to be able to get the votes in the legislature? That's a question we have to try and ask.
Yeah, that's a great question. And you know what? There's one way to find out. I've had people discourage me because they say you can't get the vote. This is impossible. But you know what the important thing is having these hearings, because there's a lot of people out there that want to tell their stories, and we'll probably uncover some more things too. So, you know, I don't care about the naysayers. We're going to do this no matter what. I think the important thing is to try to do this. And I think I hope we're going to have more supportive House members and those of us in the legislature, because The best thing about a constitutional limited republic that we have here in our form of democracy is the little guy always has a voice, no matter how little that guy is. And she has taken the legislative process, which is the voice of the littlest guys, away from us all. It's unconstitutional, and in my book, is criminal.
I agree.
I believe, and I do think it's criminal. So I'm going to just go on a little bit of a tirade. So we go back into March and April. We talked about the extensions. We know what the lockdowns were. When you guys extended her the second time and those executive orders over what, 187, 190, I can't remember what it was. It was more than one per day, right? What was the number, Matt?
I don't even know.
All right. So we're up over those numbers.
There's so many of them, and they were so confusing that 90% of the people out there that read them didn't even understand them.
Yeah. How we keep up with them, we don't know. But here's what you people will remember. She stood up there with her mask on the other day and said to us, the first thing, the most important thing that we all can do, she said, is we all need to first wear a mask. That's what she said. Then she said, if you recall, back in March, we actually crushed that curve during those first few weeks. Now, she's admitting that now, number one. Secondly, if you remember, late in March, we were not wearing masks. In early April, we weren't wearing masks.
Yep.
Dr. Fauci was telling us not to wear a mask if you were healthy, and we flattened the curve
without
while not wearing masks.
Right.
And so after this, we go into this mask mandate, which never, by the way, happened until we got into summer. But she did stop you from fishing with your own family or shopping for paint in the stores. And those were the executive orders. Those were the things on her mind. And now we've gone to, again, who's essential and who isn't. What we've said now is, I guess you can now, again, we remember, we had reopened some of the restaurants, but still kept the nail salons and the hair salons closed. Now we're going to do just the opposite. We're going to leave the hair salons open and the hair salons closed, but we're not going to let you go into the restaurants. This is absolutely not part of the statute that falls under the health department's obligation. They could take an area or a space based on needs for the health and say, we're going to shut this area down and we're not going to allow this to happen. They cannot pick and choose winners and losers, who's essential and who isn't, and what capacities can be there, because it's not under their statute.
Yeah, let me say another thing that's very important also. The statute that she's using through the health department is to protect us from imminent dangers, okay? In my opinion, COVID is no longer an imminent danger. Now, if you had a chemical plant explosion and there was a cloud, going across southeast Michigan, that would be an imminent danger and an imminent threat. But COVID is no longer an imminent threat. We know how to handle it. We know how to wash our hands. We know how to social distance. We know how to take care of ourselves. We're adults, and we need to open this economy back and get people back to work and our lives back. Because just think about did you know we have record high numbers of depression amongst college kids and high school kids, and our parents have to take that burden on themselves. Suicide rates are up. People are not getting the medical attention that they need. The solution cannot be worse than the problem. And that's where we're heading right now. And this is the step in the wrong direction. Our hospitals are increased capacity 200%. That means a lot of these hospitals went from 10 people to 20 people, but they still have 300 or 400 beds available. In addition to that, I've also been told that doctors are being extra precautious now because they don't want the liability. So what they're doing is they're sending patients to the hospitals because they don't want the liability. And 90% of these patients that they do send to the hospitals are being released within 24 hours. That to me tells me that they shouldn't have been sent there in the first place if they're released in 24 hours.
I think what we need to be looking at here truly is deaths, fatality rates. Who is dying? How many people are dying? It's still just the very elderly. Children, teens, young adults, people that are not immunocompromised are dealing with this very well. And the fatality rates among the age group is no different than an average flu season. In fact, it's very much below that right now. So that's why when you look at all this, what are we doing? We're creating this mental health crisis and economic devastation, and we haven't even seen the worst of it if we continue down this path. That's why we have to stop the bleeding right now and say no.
Yeah, there's another path that we may go down also. I've heard talk about how people with COVID, or people that had COVID, are going to have lasting disabling results from it. And I think what they're probably going to do is have a bunch of these people that will be filing for social security disability for the rest of their life. So I think that's another possibility too. So this whole thing is going to be expensive. It's going to cost us all. And, people forget, a lot of these politicians and people in DC and Lansing forget that, our government runs on what we produce, and we've basically essentially almost stopped producing anything.
Well, and I think a lot of times the legislators, not all legislators, obviously, there's some very good legislators who get involved because they have made their fortunes, they've run their businesses, their families are older, and they get involved and they serve and they give back, right? Which is the way our founding fathers established this government system to run. That's how they established it.
Yep.
But there are some career politicians that have been doing politics for so long that they forget. Look, you get your benefits, you get your paycheck no matter what happens. But the everyday average citizen out there is being so crushed by this.
Yes.
And the mental health crisis, the depression, the suicide rates, the substance abuse, the domestic abuse. I mean, my own son, we have a very stable home life, and we don't have any, issues, medical issues or relational issues in my home. We have a very stable home life. And I have a 9th grader, my son, who we have really struggled with. Lots of tears, can't go to school. He's very social, can't play football now. The one thing that gave him a sense of belonging and a sense of this is who I am, an identity.
Yes.
Can't be with my friends, can't play sports, and we've really had to work him through depression and tears. This is a young boy crying tears. And
Yep.
and when you look at, I've said so many times, when you look at my family as a relatively stable, healthy family, and this is what we're dealing with,
Yeah.
what in the world is going on, around the state? It is so unacceptable and inexcusable. And this governor must be held accountable because it's criminal. And that, one of the things I wanted to ask you, Matt, is if you wouldn't mind kind of going through, I read through your letter, and I wondered if you wouldn't mind sharing with the citizens of Michigan what some of the illegalities are that you call out in that letter, because I think it's important that people understand you are naming these things. We are going after these things, and she needs to be held accountable. This is the basis for this impeachment inquiry. What is the basis? Can you kind of go through that list so people know
Sure.
he is going to be called on these things?
Yes. Number one, she ignored court orders. She violated the Supreme Court in Michigan overwhelmingly said, you need to get the legislator involved and you need to stop this. And she completely ignored them. She put on a different hat, and now she's using, Department of Health to do the same thing that she was doing before. And that's not what the court intended. The court said, get the legislators involved in this process, and she's refusing that. So she's violated our constitutional rights. She's completely ignored due process in the entire legislative body. She's weaponized contract tracing databases to aid Democrat campaigns. Remember when that happened? She basically gave this contract tracing contract to a Democrat operative.
Yes.
Yeah.
Yes. Most people are not aware of that, I don't think, unless they follow politics closely. There's a lot that this governor has to answer for that a lot of people don't even realize. That's why I wanted you to kind of go through this.
Yeah, she's using our kids as political pawns and denying special needs students, especially who depend on the services that we need to have them, for in classroom. We need to have our special needs kids back in the classrooms. She's caused the unnecessary death of thousands of our seniors and loved ones and people that are most vulnerable, and they died alone in these homes. And many of them had to watch their, some of them had Zoom meetings to watch their person die in one of these homes. It's horrible. That's the short list, but there's probably some other things that we can add. And but the important thing is that we start pushing in this direction. And we need to stop her. We need to get our lives back. We need to get the legislature back. And this country's not about this. This country's about the legislative process, due process, and debate. And that's what we need to go back to.
So the government is supposed to be by and for the people, correct? And it seems to me that this has been flipped its switch in regards to the governor. She now believes that she is control of the people, and if they don't succumb and if they don't obey, then she will sick everybody from their licensing bureaus to anything else on those people. And they have been fearful enough of a virus, and now they're fearful of their own government, which again leads to what? What did I write in there today? Again, it was about, again, when the government and the people fear the government, it's tyranny. And that is exactly what we're under right now. When we say tyrannical, we mean tyrannical. But what it is time for is for the government to fear the people. because the
Absolutely.
people are in control. And if we rise up, they have no solution. They would have to have a common way forward. We have been doing all of the things that we're supposed to do. But going back to April, and the reason I have to go back is because we're going to talk about this impeachment, is you guys asked for the science and the data to prove an emergency still exists. We need to call the hospital association in because we have evidence, and there's evidence that proves that she demanded that the hospital association provide that data only to her own administration. It was not able to be supplied to you as leadership or to even to the hospitals. A normal way an association would work would be for us to be able to give information. If this hospital was at capacity, they would be able to look it up immediately and send them to another place that had room or beds.
Yep.
She said, get a hold of us. We'll tell you where to go and we'll keep track of that information. At the same time she did when you started asking for those questions, and we helped pass and adopt, and I would assume that we helped actually draft which was SCR number 26 and the HSR number 24, which was to demand the science and data that she never did provide. She never gave us that hospital information because that would have proven that we had not only dropped the capacity levels down to ridiculous levels, we were laying off and closing hospitals back in the end of April. And we were doing that at a time when we were saying that the emergency still existed. At the same time, we have record after record of people that went in and were sent home because it wasn't considered an emergency. It turned out that they had some gangrene in the toe. It didn't get taken care of. They went in, and by the time they were finished and put into the hospital 3 trips later because they didn't have COVID, they lost their leg. That's just one example of people did not get cancer treatments, didn't get their pacemakers updated, didn't get early diagnosis of things. We're not even looking at those numbers, and they will absolutely prove that we should have been able to take care of those people's throughout this process.
When COVID hit us, it was kind of like you're going to a fight, but you got one fist tied behind your back. That's how we were. That's how we started. Okay, but this is America, the greatest nation on the earth. We are ready for COVID. We're ready to fight COVID with 2 hands right now. Our healthcare professionals have done a terrific job. They're ready for it. We need to take this on. It may be a part of our lives for many years, just like the flu is. And but we have to get back. We need to get our rights back. And we can't continue to operate under a dictatorship in any state. Unfortunately, the sad truth is, the same thing happened as soon as we lose our faith in elections. That's another important thing to talk about too. What happens is the next step after that. Same thing happened with the Civil War. They lost faith in elections because there was inadequate elections going on, and the next step was the Civil War. So we're treading on very, very thin ice, and what could happen is could be horrible.
Yeah. And I think we're standing, actually, to be honest with you, right on the brink of that, depending on how our legislature handles things. I mean, this virus is never going to go away. Viruses don't go away. Viruses mutate. They burn through communities, but they don't go away. Vaccines do not eradicate viruses. It doesn't work that way. Any virologist will tell you that. And the vaccines are not fully, this one's going to be 40% effective at best, right? It's already mutated. The vaccine that's being released is already for a different strain of this particular coronavirus because it's already mutated. So we have to look at the real science that she won't release, the real data, the real medical and scientific information, and make informed, responsible decisions based on what we know about viruses, about what we know about infectious disease. We live with infectious diseases. They're never going to go away. We have millions of viruses and bacteria and pathogens. That's my field. I'm a PPE and respiratory protection expert.
I want to interrupt 1 second, Tammy, because our leadership in Lansing, I don't have to mention names, you'll be able to read it shortly, are jumping directly into, they're upset that the governor's chosen to act alone. But at the same time, they're making statements that the most important thing, again, is wearing a mask. They're actually speaking it. This is your territory. By the way, I don't know that there's a single legislator out there who has any idea about the effectiveness of masks. And if they did, they would just shut their mouth and stop repeating something that simply isn't true. because they are not stopping us from getting the virus. If you'll notice what happened when we did all that back in the spring, we weren't wearing masks again, right? We flattened the curve without it. We did the right things. The social distancing, yes, works. Hand washing does. All of those things we did, separating tables and all of those things. Yes, we know as we move back inside that we're going to have the virus again. All we've done is slow down the virus. Now, as we move back into this area, it's got to run through our society. Herd immunity is real. Anybody who says it isn't is lying, because the fact is the young will get it and get over it. They won't continue to pass it. They're asymptomatic for the most part. And Tammy, I just need you to talk to these people about the mask mandate situation. We know it's not there, but the governor's saying we wish the legislature would go along with us because it's the most important thing we can do.
Well, let me tell you what. I have said many times, I would love nothing more than to go toe-to-toe, head-to-head, and have a one-on-one public debate with Dr. Khaldun, who has said herd immunity is the most inhumane thing. And I just think, did this woman graduate last in her class or what? Herd immunity is exactly how viruses work. Any scientist, any virologist will tell you this. She has no idea what she is talking about. Either that or it's more sinister. She does, and she's pushing an agenda. That's my bigger concern. But I would love nothing more than to get in front of the legislature and give everybody a real education on how PPE actually works. Because none of these cloth masks, none of these surgical masks, even these N95 entry-level respirators are not rated to protect from a virus. They will not protect you, period. And in fact, what they do, and what we know even from the studies, Dr. Fauci admitted this himself and has written articles on this. If you research his old articles and his old writings, what we do know is that when you inhibit the ability of human beings to breathe by restricting their breathing, covering their mouths and nose, especially for an extended period of time, you are going to increase the risk of infection. You are going to increase the spread. That's what happens when you wear face masks. You don't reduce the spread or stop the spread at all. They're not rated for that. You would have to wear what's called a PAPR, a powered air purifying respirator, a hood, with your own source of breathing air. And that's exactly what medical healthcare workers and staff wear when they're working in infectious disease wards. That's what they wear, because that's the only thing rated to protect against the spread of infectious diseases from viruses. So this narrative that they're pushing is not only wrong, it's irresponsible, and it is incredibly dangerous. It is making things worse. And it infuriates me because this is my field. This is my profession. And nobody is speaking to the real professionals on this. It really frustrates me when doctors and nurses stand up there and say, well, we work in masks all day, and so it's not a big deal, and they do help. They are so outside of their lane when they say things like that. It should be considered malpractice. It would be no different than me saying, well, I've got a lot of medical training and a lot of medical certifications, so I think I'm going to do your brain surgery today. Let me speak on that topic. Right? I mean, it's no different. We need to stay in our lanes, and they're not talking to the real scientists, preventative disease specialists like myself, and PPE experts. The doctors and nurses only wear the PPE that they wear because people like me come in and test their environment, test their breathing atmosphere, determine what sort of hazardous atmospheres that they are being exposed to, and then I tell them what PPE they need to wear and why, because I know what it's rated for. The reason that they wear surgical masks is not to stop the spread of virus transmission. There are studies after studies. I mean, these are RCTs, randomized controlled tests, with metadata analysis. The only RCTs that have been done on face cloths, on surgical masks, on N95s show that face coverings like that do nothing to stop the spread of infectious disease from viruses. That is what a surgical mask is designed to stop bacterial spread. And, so a doctor or nurse doesn't cough onto an open cavern of a body or something like that. Or when you see them wear the face shield, that's to stop the splash hazard. It has nothing to do with viruses. In fact, that's why in 2015, there was a very serious flu outbreak. And so we did some RCT metadata analysis controlled studies on why the respiratory infectious diseases like influenza were spreading like wildfire through surgical centers, through hospitals, when all these medical professionals are masked up all day long. How are they getting all these respiratory infectious diseases? What they found was that they were not following their training. It is a very specific way to don and doff a face mask, an ear loop mask, an N95. You have to have that PPE rated. It has to be NIOSH or ANSI rated. You have to be trained on it. You have to be medically fit tested for all of this. And I go in and I do that. And the healthcare workers, when I start having these conversations with them, they go, oh yeah, you're right. And so I tell them, but you don't know why I'm telling you to do it. You just know this is what you're supposed to do. And so you do it. Well, the studies that came back showed there was so much fomite transmission from the healthcare workers touching tables, touching doorknobs, and then touching their masks, readjusting their masks. They were not following their training. They were not wearing them properly. They were not changing them out. And every time you touch your mask, you got to take it off and change it out. They were not changing them out as prescribed. And so, there was just rampant, and there still is, infectious disease spread from viruses among healthcare workers who are masked up all day long. And here's another thing. If masks work so well, and we've all been wearing them for 8 months, why is COVID spreading like wildfire?
So we need to get back to our, let's get back to impeachment. And I want to get back to this because the people really, really are onto this subject. It's something they've been asking for, is to what can we do to this governor? What can we do to make this work? And one of the questions that a couple of the questions I had for you, Matt, is in regard to, we talked about the votes, we talk about the hearings. What are some of the other people that are in the House saying? What other support do you have moving forward here in regard to what you're going to ask? We know you had this situation also, if we recall, where the governor denied FOIA requests of any government and state agency during April, May, June, and whatever it was. There were a lot of things that transpired during those days that you weren't able to ask about. Tell me who it is that might be on your team, and what do you think that the process would be going forward?
Well, if you look at my Facebook post, I have a number of members that have agreed to be supportive of this. Myself, State Representative Dare Rendon, Bo LaFave, Ryan Berman, Shane Hernandez, John Riley. We have state senators, Alana Tice, Dan Lowers, and we have some incoming legislators in the House also. Ken Borton, Steve Kara, and Patrick Outman. So that's the short list. I hope to have more support in the House. If you're watching this and you think that this is the direction we should head in to start holding these hearings, you need to contact your legislators and let them know how you feel.
So again, you file the paperwork. What is the next step once you've done that in order to request or to get the hearings underway?
This is uncharted territory. I've never done this before. So we're probably going to have some discussions with leadership to find out whether or not they're willing to do this. We're going to have to probably find out how many House members are willing to proceed, and that may take some time.
How many people do you need in order to proceed?
Majority of the House.
Okay, so in this case, you have 58 to 52 currently, and you're going to have the same after January, correct?
Yes, that is correct.
So you would need to have, you could lose 4 or 5 seats or people, but all you're asking for, and that is really got to be the messaging, is you're asking that for your ability to call for the hearings so that you can simply expose and talk about the things that the House has been saying. And by the way, that's House leadership, Lee Chatfield himself. We can't get anyone to listen. We'll hold hearings. We have bipartisan committees. No one will attend. No one will cover them. They won't show up. You got to subpoena them. The only real way for you to move forward and get the real answers for the people of Michigan is going to be to go down this road and path, is it not?
I believe so. That's what I believe. Yes.
And what has your response been from the people? I mean, we know what you're getting from some of the other side, but
tremendous amount of support. I mean, I can't even keep up with the positive emails that I've received. So it's good. There's a lot of people out there that are supportive of this effort. And look how fast we got petitions to unlock Michigan. That was one of the largest and fastest petition drives in Michigan history. And we didn't have to go out and find signatures. People found us to get those signatures, right? So there's a lot of very excited people out there that are going to be, I think, excited about holding these hearings.
Well, and I think they better be, if you're out there, I don't care if you're Democrat or Republican, again, I do not believe, and if any of you can point it to me, just show it to me, and I'd be glad to stop talking. if you can show me where our constitutional rights and individual freedoms go away during a pandemic, just show it to me in the Constitution, Michigan or the U.S. Constitution. I do not think it's there. That would mean that you have no basis whatsoever when you know absolutely that the governor unilaterally took away our individual rights and our freedoms and caused undue harm on us as individuals, on thousands of business owners. As it turned out, it was unilaterally unconstitutional. She knew it all along, just like the 20 days or the 28 extra days she had. That was the most frustrating thing for the people because the media carried the water for her. They began to act as if she still had the power. By the way, the power were words she used, and her Keep Michigan Safe campaign used, is that they wanted to maintain the power for her, and that if you took away her powers at the time of the pandemic, it was going to kill people. So, Matt, I just want you to know, to give us some hope as to what you're doing. You have the power of the purse strings also. You don't need to fund certain things for her. You can hold back things, and you can also put certain things into bills that have to be funded that can also get us more of our securities back. Can you not?
To a certain extent, we've already passed the budget, and we probably could do some negative supplemental bills, but I don't think that's going to be a direction that we're going to head. We are in a difficult position when we have a Democrat governor. I mean, like it or not, she has to sign the bills we put in front of her if she wants them, and she likes that veto pen. So we are in a very difficult position right now, and it's difficult to fight back against her. So, but this is the direction we're heading. I think it's encouraging for people listening out there to know that there are people that are fighting for you, and that's what makes this nation great. We have a path. And I think we need to go down that path, and because there's just too many people out there that are hurting. Yes, there's people that are still dying, and there probably will be people still dying from COVID, but we've reached a point right now where there's going to be more people dying because of these lockdowns and these unilateral decisions that she's making. Detroit's much different than Dexter, Michigan. Every single community is different, and that's why we have 110 different House seats in Michigan, because we have such a vast, different culture in Michigan. Just to wipe out all the legislators and their representatives and the people that they represent is just wrong. It's criminal, and that's why I want to continue with this. So we need to get our government back. We need to get our state back, and we need to put the people back in control. Listen, guys, I have another call I've got to take. I can wrap it up here in a couple minutes if you'd like.
Okay. Yes, and one thing I want to mention, I'll let Tammy ask a question too, is we need to remind all the legislators that 72 counties voted for President Trump. They represented those districts almost unanimously, and a lot of the Democrats who are there also are in those counties that voted for President Trump. The reason I say that, it was a stark decision to make. Do you vote for individual rights and liberties, or do you vote for lockdowns? They voted for individual rights and liberties, and I think we have to defend those. Yeah. What else do you have for us, again, to give us a little bit of hope moving forward? God's in control ultimately. And, I want to do my part to make this nation appealing in his eyes again. And, I'm a fighter. I enjoy the fight. And that's what I am by nature. I've been fighting for a long time as a bail bondsman and the PI. And so I'm glad, I'm proud to lead this effort. And but I'll need people out there to know that you need to have my back too, because I can't do this alone.
Absolutely. And all of you that are watching, please share this and please reach out in encouragement. We've heard your frustrations, but you also need to encourage your legislature when you hear things like this.
Absolutely.
And Matt, I just want to encourage you also that we don't know what the outcome of the impeachment will be, especially after January when we lose the Supreme Court and things like that. But I just want to encourage you to just keep doing the right thing. I want to thank you for doing the right thing, and I want to encourage you to do the right thing, because if nothing else, it shows that you're doing your job. You're exposing the criminal and illegal behavior, and who knows what that will lead to. We really don't know, but the point is to just keep doing what you know is right, to hold her accountable, because that's what we are told to do. That's what our governing documents in the United States tell us to do. When our government becomes tyrannical and does not protect our constitutional rights anymore, then it's up to us to expose and take it back.
It is our responsibility, 100%.
If you obviously are going to be moving through this process, and the press is not going to give you much airtime, so please reach out to us as you make progress and you process through this so that we can keep the people informed. We definitely want to keep
Right.
in touch with you throughout this process so that people know where things are at and what's going on, so we can proactively use our platform to communicate.
Right. Sounds great. I got to run, guys. Thanks so
All
much,
right.
Tammy. Thank you, Ron.
Thank you.
We'll talk
Thank
to
you.
you later.
Bye-bye.
Thank you.
God bless you.
So everybody, I know that was a great, we knew he had a crazy busy day today, and that's the reason somewhat he was late. Want you to know that there's a lot going on. If you'll notice, the one thing we didn't even get to in that conversation, which is, I think, again, on purpose, is the issue in regard to the audits. He is 100% in favor of the audit. Matter of fact, the latest letter that went to the Secretary of State was signed by 40 legislators, including Representative Maddock, demanding a full audit by the Secretary of State. There also a new email went out from Unlock Michigan demanding the Secretary of State validate these signatures. There's no reason to delay or wait any longer so that we can get that 1945 law repealed because we have the votes. But we're going to need you. You know, you can come on here and you can answer the questions. You can sometimes you do share these emails or these videos with people. But we have got to stand up and say we're not going to close down again. I read 2 weeks ago when hundreds, if not thousands of you said, no more lockdowns, we will not do it again. And I believe there are a lot of you that said that back then that are going to shut down. I really believe it. I'm sad to say it, but it's true. Everybody gets to the point and goes, yeah, well, I don't know. Oh, I don't want to lose my license. It's going to cost a lot of money. Look, if thousands of us do it at the same time, there is no sense. There's no ability for them to be able to uphold this. Look, the health department has just released in District 10, for instance, that they can't even have enough manpower to be able to have you tested and approved to go back to work. They're going to have to actually, guess what? Trust you. That if you don't have symptoms for a period of time that you can go back to work now because they don't have the resources. How do you think they're going to have the resources to come and check every restaurant and every place that decides we can continue to do things safely as we have been, but we can also continue to be open to take care of our people, our employees, our family, and our businesses? We're going to need to support them, and we have something coming up on Friday. We want to support the restaurants, the restaurant owners. I'm not going to give you a location or what's happening yet, but on Friday afternoon, we want to have a rally that is going to be hopefully for those restaurant owners and those people who work in restaurants to show up in big numbers so that we can give them strength together to be able to battle what we believe, again, is unconstitutional and illegal actions by our governor, and our legislature is listening to the legal process behind them and saying, we're going to have to go through the process. We're going to have to look until what? Until everybody's closed up and these businesses are destroyed. If you can't, you have to think like Carl the barber, who says, I'm just trying to feed my family. I'm just trying to do my part. And what I believe is if you can go across the street and it's safe, then you can come in my places it's safe because I have taken the precautions. And I believe that those things need to be done. We have to stand up, Tammy.
Yeah, absolutely. And you guys, what you have to hear Ron's heart and you have to hear my heart. We are business owners. We have been devastated. We have stood up and we understand, you know, we're not just talking to you. We're walking the walk with you. And Ron's business has been seriously affected. I'm down to one person working for me. It's just crazy what is going on. But if we don't stand up and be willing to risk it all, here's the thing, like I said earlier in this interview, if these restaurants and these businesses have to shut down again, trust me, it is not just for 3 weeks. She is going to try to force stay-at-home orders again. She's just saying things. She's just putting things out there that are so far outside of the scope of authority that the Department of Health and Human Services has. They have the right to prohibit gatherings. They do not have the right to do the face mask mandates. They do not have the right to tell you what businesses can stay open and what businesses can close and this and that. They don't have the authority to do what they're doing. So what makes you think she's not going to issue more stay-at-home orders? She is going to. She's going to shut us back down. So if you know that your business is not going to survive that, why wouldn't you just say, I've had enough. I'm standing up and I am taking a stand. I'm speaking up for my rights and liberties. And here's the frustrating thing. And It's just the reality. It's human nature. Ron and I have talked about this, that we come on here and we tell you and we encourage you and we do the calls to action and we live by example. We are doing the exact same things we're telling you to do. And it's hard and it's scary. And yes, it's financially difficult, but we've already been frustrated and emotionally taxed, and our finances have been, severely impacted and all of that, right? So we're not just telling you to do something that we are not already doing ourselves, but we know that a lot of you will get on here and say it and then not do it. And so it gets frustrating, because when we're at this point in our country's history, we all have to stand up together. We all have to link arms, because she can't control us if we all stand up. But if half of us do and half of us don't, then she can stick the health department on. She can target you more individually if we don't all stand up.
And if you recall, when we shut down in April, what had happened at that time was people shut down because, again, we didn't know what we were facing, right? So when we extended in mid-April, by the time we got to May, I think it was the 13th, we were supposed to be free again. If you remember, everybody made their plans, restaurants and everybody, before she locked us down again. At that point in time, it was much more difficult to open because you've been closed for a while. You didn't have your people. They were all on unemployment. But you have a decision to make between now and tomorrow, or in this week at least, to say, you know what? No, I'm going to just turn my sign. I'm going to turn my light on, and I'm going to say no. And if we all do this together, or a large number of you do this together, it will create strength and unity. And I think the one thing I want to talk about, Tammy, right now is that this is going to be the first test. And I need you again to do a couple of things. I see we got 600 of you watching live. We've got thousands of you that are going to see this video in the next 24 hours. I need you to forward this video to others who want to hear about the impeachment and lockdowns. But this rally that we're going to hold Friday is going to be at a restaurant. We're not going to talk about it on a live. We're actually going to become covert like we need to in order to have real action. We need the grassroots to respond. If you are and can, sign up under our standupmichigan.com and give us your email address. We're going to be sending out an email to our 70,000 people to notify them of where and when this is happening. In addition to that, we are going to do a separate video that we're going to post on our locals.com. Again, it's free 12 months. If you're there, you're going to see that video. That video is going to give the details again about what's happening on Friday afternoon. If you own a business or know someone who owns a business that is going to be affected by this, a restaurant, especially a bar, we want those owners, those managers, and those servers to come to this event. We're going to try and get the Restaurant Association. Tammy's reached out to them to get a spokesperson there. By the way, those people represent who? They represent the bars and the restaurants and the owners. They need to stand up for them and say, we have done a good job. We've prepared ourselves. We went through the difficult times, and now we cannot be forced to close any longer. And this is a stand. If you show up, we will get coverage. We will do some lives from there. We will share it across the state in an effort to get thousands of you to stand up and say no. They have nothing to do if we stand up. But again, if you decide you're going to cower and go back home and you're just not going to open and it's just not worth it, our freedom is worth it. It really is. It's time for us to stand up. What we've been saying the last few days, I've said it to Tammy a number of times, is if not now, then when? And if not who, if it's not you, who? Sooner or later, we have to be the ones collectively or individually being able to set the standard and get that for other people to believe and do it together. It can't just be for a rally and an event. It's got to be to instill change and to let them know who's really in charge. It's the people, it's the Constitution, it's our individual rights. It's not the governor.
Yeah, and I want to challenge you all that you have seen your leaders. You have watched Garrett and Ron and myself and some that work behind the scenes with us, and they're there tirelessly. Your leaders out front have been standing, and trust me, it has taken a heavy toll on us.
Just a second. Hey, I got a word here. I just got something from Laura in. It came on a screenshot. The Michigan Restaurant Association filed an emergency injunction against Whitmer and the order today.
Yes. Good. You guys, I
to
have
the
been
MDHHS.
emailing the CEO of the Michigan Restaurant Association and Tommy Brand, and I have been putting your representative out of Grand Rapids. I have been putting the pressure on them, and I have been telling them, we are standing. Are you going to stand with us? Are you going to stand for your members? Because that's what they pay your dues for, right? And so I've really been challenging them. I've invited them to the rally with us to represent the restaurants, to represent the bars. We're going to put that out covertly, like Ron said. We're not going to say anything now, but I'm changing my plans for Friday afternoon, and I'm going to be there.
We have people that are involved down to the Lansing level.
Yes.
And so this is official. The Restaurant Association filed for an emergency injunction.
Awesome.
That means that they cannot pick winners and losers and who's essential.
That's right.
Every one of those servers, those business owners deserve to be open.
Absolutely.
And we are going to fight, but we have to have you show up. And
That's
we
right.
have to have you tell your local coffee shop, your local restaurant, they do not need. Now, look, if they have underlying conditions, if they have a big spread, if they've had COVID in their place, we understand shutdowns for a period of time. We understand what they have to do. But for the majority of us with young people and whatever, we simply have to use this as the time for us to stand up.
Yes,
we're going to do it together.
Yes.
We need your email address. We need you to join our locals. We're going to give it. I'm sure that the word's going to get out, but the fact is we need you to show up. By the way, the weather, it's in West Michigan. The weather is going to be sunny and 53 degrees on Friday.
Nice.
They have outdoor areas. They're going to have porta potties. They have tents. It's going to be outdoors, which is legal to some extent anyway. But the place is going to be fully open for this day. And it's going to be for you, for those restaurant owners around the state to stand together. We certainly hope that Tammy can get somebody from the hospital or the medical, the Restaurant Association, to be able to show up and be able to speak for their people while this injunction is being considered, because they do not control us.
Amen. And like I was saying, we cannot be the only ones standing tall anymore. This has been a test, you guys. Like Ron said, this is a test. You've heard us. We've encouraged you. We've empowered you. We've got this platform. You know your leaders have got your back. Now it's time for every one of you to put our money where our mouth is and actually be the ones to stand to. I mean, I know you are. I know you're there in spirit.
Yeah.
I'm not saying that.
Yeah.
But we also know that a lot of people will say it behind the screen, and when it comes time, it's just too difficult, or it's too far away. And so share this and show up on Friday. We'll be putting out the information before
when that email comes to you, if you're on our email list, please forward that email to everybody on your email list. The same thing when it comes to the locals. Share this video to everyone you have. Text the link, put it on your own personal pages and say, please listen. There's a call to action included. There's information on the lockdowns. There's information on impeachment. People will listen and watch it. They'll comment on it, and they will go do the same thing you're doing so that you come. And when you come to this event, I want you to come with American flags. We want a visual and a picture, again, of what we stand for. We're there to stand for the blue-collar workers, the restaurants of this Michigan that have fed us and taken care of us. They did takeout for us when they were losing thousands of dollars a week in a lot of cases because they knew that it was the right thing to do. And now it's time for us to stand up for them.
That's right. And it's my birthday weekend. I think I'm going to change my plans, and instead of staying at the JW Marriott downtown, I think I'm going to be staying in this little town and supporting this little restaurant.
By the way, there's a brand new little inn there that just opened 2 weeks ago that is pretty neat, but limited.
There you go. So come and join me. Come and join me for my birthday. Come and stand and protest with us. Support these restaurants, and please share this with everybody that owns a restaurant or a bar or a coffee shop, like Ron said, and get everybody prepared to protest and to join us on Friday.
And we're going to give you, by the way, if those restaurant owners come, if you talk to those restaurant owners, we're going to give you that microphone. We want to give you the ability. We want 100 of those people to tell their story that we can record and be able to share with others so that we get down to real human interest stories and not just talk about, again, a virus that we're aware of, but talk about human lives and what they've put everything into. Because guess what? The banks don't care about a virus. They're not going to renew and give money for restaurants and whatever else if they close down again. Their businesses are going to be in such a horrible shape that again, we're going to have this effects for years to come. So we're going to close now. We want you to share this video. It was a long one, but there's so much going on right now. We need you to fight. We need you to show up. It's going to be on Friday, and you're going to get the information covertly. Share it and the information, and we want to see you show up in huge numbers.
And let me just close with this. Guys, remember, we in Michigan are truly the revolution. That's why I love that song by Becca Shea. We are the revolution. And if you show up, trust me, this is going to spread nationwide. We are not the only one dealing with a governor like this. All these other states that are dealing with these governors that are locking down and they're doing the same thing. This is going to spread like wildfire, and it is going to encourage those citizens in other states to do the same thing. So we are part of something way bigger than just us. We are the revolution, not just in Michigan, but in the country. So what we do on Friday is going to be very, very important and powerful for this country to help save this country. So I hope to see you there.
It is indeed. And so watch for that email. It's going to come out to you tomorrow sometime. So you're going to have 48 hours. It's going to be on Friday afternoon. We're guessing, again, we're gonna call it between 3 and 4 o'clock. And because it's a restaurant, you can feel free to come whatever time you feel at that point in time. It is in West Michigan for those of you that want to know, but you're going to get it, and we're going to find out whether we can get you to answer the calls to action from a covert method outside of the social media platforms and still have us show up in big numbers and make a difference, because it's likely what we have to do going forward. It'll be on our locals too. So appreciate your time. Everybody have a great day. This is going to be a terrific weekend and a terrific Friday. You've got to stand up together, spread the word. Thanks again.
Thank you, everyone.
And love you.
Have a great day.